I don't want to put my son on the front lines.
It's a dilemma so many parents are facing, whether to let their kids go back to school during a pandemic.
It just doesn't feel safe enough to do so right now.
While some school boards are planning for staggered class times, mandatory masks for older kids, and physical distancing signs in the hallways, will it be enough to keep students and teachers safe? So joining me now to answer your questions, two infectious diseases specialists, Dr. Susie Hoda and Dr. Srinivas Murthy. Hello to the both of you. Dr. Murthy, maybe you could take the first question for us. Here it is. Should teachers adopt the same routine that healthcare workers are doing, such as taking work clothes off in one part of the house and immediately washing them?
Yeah, remember that healthcare workers changed their clothes primarily because they were providing care to patients with confirmed or suspected COVID-19. It's a very different situation from teachers or others where the risk of exposure is much, much lower. So at this point, we wouldn't recommend that all teachers or others who work in schools should take that level of precaution when changing their clothes and washing them before entering the house.
Dr. Hoda, is that advice that you would agree with?
I absolutely agree with that. I think that they're very different situations, so I don't think that it's important to have that kind of routine.
All right, maybe you can take this next question for us as well. How easily can the virus be transferred from clothing to people? So along the same lines, but this person says, I'm thinking specifically when a child may be releasing droplets in the air as they talk or shout, or when they accidentally sneeze on another person.
Right, so one of the good pieces of news is that we're learning over time that the virus doesn't seem to really last on surfaces for that long, and particularly on clothing or softer surfaces. So for this to really be a realistic mechanism of getting infected, you would need to be pretty heavily soiled on your clothing with that cough or sneeze, and then touch that fairly soon afterwards, and then touch your eyes, nose, or mouth so you can transfer it to surfaces that you get infected through. So I think it's possible, but it's unlikely, especially if you're going to be wearing a mask while teaching. But to me, it's a reminder of how important it is to just clean your hands frequently, because you can interrupt that chain of transmission just by washing your hands.
Right, okay. Dr. Murthy, maybe you can take this next question. Is a student more likely to come into contact with the virus in a small, enclosed classroom with unmasked students, or in an open hallway with masked students?
Yeah, so what we know about sort of large-scale spreading events is that closed spaces, lots of people, poor ventilation, no masks are all situations where transmission would peak. Open spaces with masks would, I guess, be a lower risk exposure than the small enclosed space without masks. That being said, there are ways of limiting that risk in that small enclosed space with distancing and improved ventilation in that space.
Right, and I guess, Dr. Hoda, I'm thinking the duration of exposure matters there too, right? I mean, you're sitting in a classroom a lot longer than you are in the hall.
Yeah, absolutely. It's multiple factors that actually increase your risk. So it's the duration, the number of people, the concentration of the people in that room, how big the room is, all of that. The ventilation is mentioned earlier. So, I think transient passage within a hallway, especially if you're wearing masks, seems to be a fairly low risk situation compared to sitting in a classroom for hours.
Okay, Dr. Hoda, this is a really, really important question that I've heard over and over again. I have two grandchildren that are in my bubble. We've had lots of close contact over the summer. Once they're back in school, will I still be able to see and spend time with them?
This is a really tough question, and it's because, we're still meant to keep fairly small social bubbles to limit the risk of transmission. But just by having children come back to school, we're inevitably going to increase their social bubble size. And by extension, that's going to apply to their immediate family. So, my personal feeling is I think we're going to have to reconsider what we do with social bubbles as we move forward with schools reopening. And I suspect that that's going to be guided by what's actually happening in terms of COVID-19 community transmission at the time. But of course, we'll take the lead from our public health authorities. I would say in the meantime, as we're trying to understand how things will look as we reopen schools, it'll be still possible to have these kinds of visits, but important to maintain physical distancing as well as, hopefully be outdoors or in settings that are lower risk.
And this is a big one. So, Dr. Murthy, I want to ask you the same question. I mean, and like if you're a grandparent trying to make that decision, right? A teenager's gone back to school. Is the bubble burst? I mean, yes or no?
In a way, our bubbles have expanded with going back to school. And I think everyone's individual acceptance of risk is going to be different. As Dr. Hoda mentioned, a lot of this is going to be driven by how much virus is out there in our communities. And our tolerance of risk will obviously change as those numbers change.
All right, tough question. I appreciate your answers to them. Dr. Hoda, Dr. Murthy, thanks so much for your time.